Thank you. Hello, I'm Dylan Roberts. I'm the CIO from Leeds City Council. And this presentation is going to follow on a theme really from the last one, because what I want to talk about today is not just about health and social care integration, but also about the concept of delivering outcomes as opposed to services, and the concept of what a platform-based approach means to Leeds. I know there's lots of different opinions on platform, but that's what I want to cover today. First of all, don't need to say to people in this room, public services is in a crisis. I mean, if you look at the NHS alone, it's a £24 billion gap, I think, by 2020. In the Leeds economy, it's a £680 million gap. The government, the local government in the spending settlement, Leeds City Council, it's about a £105 million gap. So ultimately, you know, we can automate our processes as much as we want. We can put fancy websites in place, etc., etc. But to be quite honest, that is not really going to cut it, in my opinion. Not to say that we shouldn't make efficiencies in the way we deliver services, and we shouldn't be automating those services, but we also need to be thinking about how we can deliver better outcomes for our people in a different way. And that's what I want to cover today, with a particular focus on health. So, you know, what we're about really in Leeds, from a health and well-being perspective, is about delivering better outcomes for Bob. And that is to take a whole system view of Bob. So one of the advantages we have in Leeds is we've got a very good partnership across the system. So every single health and care organisation, every single health and care CIO and clinical CIO, and we have got people in adult social care who we refer to as clinical CIOs because that's an NHS type term, are working together jointly on how across that system we deliver better outcomes for Bob within the spending envelope that we've got. And the key thing about that is that it's not just about the health and care services, the traditional NHS and local government providing those services. It's about a whole circle of care. So how do we enable citizen groups? There's 36 neighbourhood networks in Leeds made up of voluntary sector organisations. There's 90 mental health organisations and providers. How do we combine and enable all of those partners across our place to focus on delivering better outcomes for Bob? How can we enable Bob himself through technology to frankly look after himself and enable his circle of care to do that, so it prevents him coming into our system? And our approach to that, from a technological point of view, is to take what we call a platform-based approach. So that is a platform whereby, based on standards in particular, and I'll come on to it, whereby whichever one of those partners, potentially any of those partners, can access that and use that, where Bob potentially can interact with that to deliver that outcome for him. This is a representation, I'm not going to go through this in any sort of detail, but this is a high-level representation of our platform in Leeds for health and well-being. This is a social care lens, and basically this is something which everyone across the Leeds system is signed up to delivering. On the right-hand side, what we've got is how we're going to integrate our health and care systems. So this is how the professionals and practitioners are going to integrate around health and care. On the other side, it's how we're going to look at trying to use even consumer-based devices and technologies to help people to basically become more self-sufficient and look after themselves. And I think the key part of this, in terms of our design principles for how we're rolling this out and how we take a platform-based approach in Leeds, is to almost try and disaggregate things. So what we've got from a data point of view is we've got sign up across the city to a particular set of design principles. And there at the bottom, we've got our data layer, which is citizen-owned data. So Bob at home might have an app which he uses to manage his particular long-term condition. He's got his citizen-owned data. Fundamentally, that can potentially be transmitted across and be part of the professional care record and link into the organisational data. And in between, we're making anything which is open data, which is available on our Leeds Data Mill, which is a citywide platform, not a council platform, open to a marketplace who might want to provide solutions and services that Bob can use. All of it has to be based on simplified systems, open APIs and an open type approach. So by way of example, the Leeds Care Record is a care record which has a viewer and is used across the 7 main health and care organisations across Leeds, including the hospital, GPs, mental health and the council. This is a virtual ward viewer. So if you are a GP in Leeds and you walk into your GP in Leeds, well, the GP fundamentally can see where all his patients are or her patients are, at what ward in the hospital or hospitals across Leeds and when they're due out, etc. Social care similarly have got that particular view. So from that point of view, what clinicians are saying are they are making far better clinical decisions. They're making decisions much faster, especially decisions around medications, for instance. We're improving discharge, enabling speedier discharge, which is the big problem in Leeds. We've also got better combined data analytics and a combined approach to that, which gives us a better view of how our system's working. But the key thing about an open platform-based approach is that, from a smart cities point of view, we are looking at ways and working with various partners, Samsung, Yeko, people like that, on how we can bring technologies into people's homes to enable assisted living, enable people and assist them to live better lives. The key thing with the open platform approach is that you develop something specific and individual to a person's individual need. Fundamentally, because of the open API specification and requirement, it can integrate in. And that is ultimately, that's giving you your whole system approach. The other thing is, and I think it's quite important, and I think it's already been raised, we do need to take more of a citizen-led approach. So in the same way as we follow an agile approach internally to get user-led design, I think it's quite important when you're looking at outcomes as opposed to services. If you want Leeds to be the best place to grow old in, which is one of our outcomes, our city outcomes, then if you're going to start thinking about solutions to enable Leeds to be the best place to grow old in, you need to co-produce those with citizens, older people there. So we've built an urban sustainable development lab, which has been applied. It's been used in other countries, in India, Portland, and Sweden, where we co-produce solutions that, in this case, older people have got. And those solutions involve things like one of the biggest issues for older people in Leeds, and I think it's the same everywhere else, is transport. So older people, one of the biggest issues older people have got in terms of using buses, they never know when they're really going to come. Therefore, they're a bit worried about getting to that bus stop at that time. So we've put a simple analog system, not an IT system, not an app system, based on open data, which we get from the Passenger Transport Organisation, which is basically a bus beacon. So in 6, it's only a prototype, in 6 of our GP surgeries, we've got a little bus beacon when you press a button, and for particular buses, it will give you a countdown. That has raised, for that group, the view is from Arriva buses in particular, it's raised the number of older people using the buses by 18%. Therefore, you're getting people moving, you're getting people doing stuff. The idea of this, and what we're really keen to do with this, is potentially have a situation, it's what we in Leeds call civic enterprise, whereby the startup that developed the bus beacon, and has developed a few other things, what can we do from an economic development point of view to get bus beacon to be something that can be scaled across the city of Leeds, but potentially properly productised and potentially sold in other places. It's delivering an outcome where the council, apart from making sure the open data is there and stuff like that, council aren't ultimately involved in it, apart from in facilitating its co-production. But again, we have to insist, and this is what this slide's about. We talked about the Leeds Care Record before. NHS England kindly, as part of the last Tech Fund 2, gave Leeds just over £1 million to Leeds City Council to basically productise almost the approach to the Leeds Care Record, which is the Ripple programme. So the Ripple programme is there. It provides an open requirement for care records, a governance model, information sharing model across the organisations, a viewer, the whole toolkit for how to implement an integrated care record. so it can be simplified, and it's simplified, it's standardised to be shared by other areas. So if other people want to use that, the whole point of that is that that's something that you can get to. But the important thing there is that those standards are important for when we open up and develop other things around individual citizens' needs. I just wanted to make the point before I close on digital inclusion, really, or digital engagement as it's known now. You know, because from our point of view, of all the prototypes we've run multiple prototypes with citizens, older people, isolated older people, various prototypes. And the big thing that comes back is you can put as many fancy devices, blood oxygen monitors and this, that and the other in, smart stuff in people's homes. But there is one platform which is ubiquitous and can provide an awful lot of information and advice, especially for older people, and that's the internet, basically. So from our point of view, we've had a scrutiny inquiry on it, and you know, digital inclusion or digital engagement is a big priority and something we need to progress on. Just to say, you get the usual challenges. I think CIOs do need to take up the leadership challenge in terms of you know, we haven't necessarily always got system leaders who are taking a system view, and there's the usual issue of organisational boundaries of controls, government silos, money and all that, but I think, you know, we've got a role in trying to break some of those down. So just to conclude on, the recommendations are really, and this is recommendations we put across to the health and care system through the Pioneer Network, really important that you connect with your peers across place. It is possible to think outcomes, not services. There are design principles out there. There's a mix of them. Local CIO Council, Socitm, Local Gov Digital will come up with them. Use those sort of design principles and apply them. And don't be afraid to copy and take what other people are doing. We certainly are in Leeds. We might be good at health. We're not very good at transport and other things, and we're basically trying to take that from the likes of Milton Keynes or whatever. And finally, there is money for integrating care coming. So every area has to put in a digital roadmap submission by June, which tells the NHS England how you are going to be paper-free at the point of care, and that comes with 1.3 billion quid. So some of those place-based approaches and the like are really important to that. So if you're not talking to your health colleagues, or health colleagues, if you're not talking to your local government colleagues, do so in terms of writing those submissions, and feel free to contact us if you want Ripple to help with that. And that's it. Thank you.
So much that we could ask from everything you've done. It sounds like incredible progress on cracking some of the biggest issues that, you know, a lot of these conferences are talking about: standards, requirements, technology, how you break down those silos. If I could just pick up on one point, and it follows from Theo's comment around subsidiarity, like what is the right level to actually do all these things? I noticed you were talking about standards and getting the technology right, getting the platform right, and you finished by saying that actually everyone is going to have a plan for how we integrate these services. Where do you see, what is the right level for all the things you've just spoken about? Is it a city level? Is it each local authority trying to take the initiative? Or what help is needed from either central government or elsewhere?
Yeah, I think there's different levels for different things. It's not a straightforward answer, really. Yeah. So if you think about place and health, for instance, if you're thinking about, I don't know, cancer care, for instance, cancer care is at a regional level, so it's at a Yorkshire and Humber level. So there's happens to be Leeds Teaching Hospital in the middle of that, which is a cancer centre. So that is at that level. In terms of some of the community stuff for Bob, for instance, well, there's 36 neighbourhood networks across Leeds. That's, at some cases, almost at a street level. So there are different levels to apply this, and that's why, from my perspective, this big push around open standards and open approaches are quite important. So regardless of what you're doing, if you are striving towards that open approach, it doesn't matter what level you're at. Yeah. I think if you use the care record, for instance, or you use the Ripple has developed an open source care record viewer. if any supplier in the country complies to that open API, that viewer can view it at any level. So you could have a view across the whole of Yorkshire number, and there's multiple back-end care records in that scenario. Does that answer the question?
It does, it does. It's amazing stuff. Questions from the audience? Other than, please, Dylan, can I have your email address so I can come and find out how I do this in my area as well? Anyone? If not, well, just one more. Oh, no. Dan, we'll just wait for the microphone to come down. And lots of people know who you are, Joss, but if you just remind us.
Hi, Joss Crease. Dylan, very interesting, and you know, it's great to see that Leeds is continuing to make such good progress, and certainly there are some key takeaway messages there around open, shared, and integrated across the whole spectrum of services. I'd be interested to know what's been the single hardest bit for, let's say, the whole collective of organisations there to get to the point you are today. I guess it's probably not the technology, but I'd be quite interested to know what it is candidly.
Yeah, I think the biggest difficulty across Leeds has been the issue, well, there's loads of them, but I'll give you the top two actually. One issue is the issue of organisational boundaries and control. So this issue of, well, dare I say it, system lead is actually taking a system-wide approach as opposed to an organisational approach. And I think it's understandable in a way because, you know, from a financial point of view, which is the second issue, from a financial point of view, we have not got a whole place budget in Leeds. Some places have achieved that. So the complications of trying to develop business cases and getting everyone signed up to that is difficult. People do tend to, if you've got a cut to make in your council, you know, it's difficult to get those sort of things to be done. So it's getting people, I guess, to take that place-based approach.
Sadly, that's all we have time for. But ladies and gentlemen, please put your hands together to thank Dylan Roberts for that fascinating presentation.